it's traumatic enough to have your daughter kind of disappear before your eyes and you can't stop it. And throughout treatment, we were receiving really good help from the eating disorder professionals in the community through outpatient, but she was progressing in her illness, and quite often we would be met with denials. They would ask for an extra day of care and they would get denials. At one point in this journey in 2010, there was a team that our insurance had paid for. They had designated her to see, and she was seeing them, and then she was continuing to fail in her health. And the team came to her father and I and asked us that we should intervene, that she needed inpatient help, or they were worried that she wouldn't live. At this point, she was admitted to an inpatient facility in Chicago. And they were telling us that it would probably be months before she would be rate restored, and for her mind to have an adequate amount of healing, for her to even have therapy be effective for her. She was not well. And then after 6 days in this treatment facility, we received a call that our insurance company was going to stop payment. But at that point, when we thought we were very close to losing her, and we had thought that, but we were being told that by professionals, and then to have it be cut off.
After just 6 days?
After 6 days, when they were saying months, it was terrifying, and so I would try to call our carrier. I was just put off and put off and put off, and so I was desperate, and I didn't know what else to do, and I went to Hobby Lobby and grabbed some cardboard and grabbed some friends, and I went and picketed our insurance company. Just wanted to have someone to have a conversation about the insanity of this, and my daughter's life was on the line, so it was a desperate thing, and I'm normally a very reasonable person, and I'm a professional. I work with physicians, and
Yes.
It just was a desperate act, but it was a desperate thing.
So residential, which is the highest level of care you can get, is $30,000 per month. And usually maybe it'll cover like a week to 2 weeks just so you can get medically stable. But for me, I know personally, like, I was not at a place where I could be open with someone, like, and talk to my therapist. Like, I'm just getting to know you. Like, how am I supposed to reveal all these feelings I had and suppress all these feelings in like a 2-week time? It would take me 2 weeks just to get to know you and trust you. Like, to talk about why I was using an eating disorder, like, and all the things that I kept inside in 2 weeks is not enough time. So like what happens is you maybe gain the necessary weight, but then you leave with the same feelings, if not more.